Abdominal distension and bloating is a common complaint of the mother. So you assess it in your way, scientific way, and see whether she is correct in her understanding of abdominal distension. If you don't see anything, then you just counsel, explain, and if it is a little bit of there, commonly it is. So take the history of diarrhea. Diarrhea has hypokalemia and a little bit bowel lobe distension and abdominal distension. Listen the bowel sound, whether they are decreased or they are exaggerated. Borborygmi, hyperactive bowel sound. Take the feeding history. If the child is malnourished, you have frequently hypokalemic abdominal distension. Palpate the abdomen. Look for features of organomegaly, liver, spleen, your kidney, renomegaly, lymph nodes, and other tumors, Wilms tumor, neuroblastoma, and so forth. So fecal matter, constipation, and then big fecal matter. So examine and find out which one it is. If it is, you go for investigating in its line. Suppose hepatosplenomegaly, jaundice, anemia. You think of the hemolytic anemia, thalassemia, by far the commonest in this country. And if you have the neuroblastoma, hard irregular mass, you look for the BP, toxemia, and metastasis. If there is, your renomegaly, the palpable kidney with the tough capsule, you think of your nephroblastoma. Again, see the BP, see the urine for hematuria, and investigate further on that line. And the fecal mass, yes, do the PR and relieve it. And if not, give fleet enema and investigate, take the history, and then look at the spine, and so and your and given laxative, sodium, maybe sodium picosulfate, and and hemorrhoidal ointments 2 times daily for 1 month or so, and everyday regular bowel evacuation, they are important. Heart disease, yeah, it is possible in any stage of the life, commonly in the early stages. So in my milder cases, they can present later also. So and copacesis, the functional constipation, have other functional disorders. So look for the full bladder. So unable to evacuate the full bladder, there is neurogenic bladder. It is due to spinal cord lesions, meningocele, meningomyelocele. Frequently, it has brain defect like Arnold Chiari malformation. Then the other way, the abdominal distension can be due to ascites, commonest over here renal, nephrotic syndrome, and renal impairment, and acute kidney injury, chronic kidney disease, and the rarely cirrhosis. So look for the signs of the of these diseases, massive proteinuria, the renal impairment for creatinine and others, urine sediment, ultrasound, and CKD. Look for the CLD. Look for the stigmata of liver disease and do the liver function test, bilirubin, ALT, gamma GTT, AST, and so forth. And finally, cirrhosis, yeah, might not to go to biopsy. The viral markers, metabolic markers, they are to be done in those cases. So if you do not have any objective findings, you do not have even protein malnutrition, you can give blindly the potassium 2 to 3 milligram per kg for 7 to 10 days. If you are very much convinced that the distance is the hypokalemia, or you have lab data of hypokalemia, so 3.5 and below, so give potassium, and most of the time you have happy outcome.